So reactive attachment disorder is characterized by children having a pattern of developmentally inappropriate attachment behaviors with caregivers. Welcome back, Straight Talkers. Today I'm going to talk about reactive attachment disorder and how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Reactive attachment disorder, or RAD, is listed under the section Trauma and Stressor-Related Disorders in the DSM-5. So reactive attachment disorder is characterized by children having a pattern of developmentally inappropriate attachment behaviors with caregivers. And they'll rarely or minimally turn to them for things such as comfort, support, protection, and nurturance. And this is despite them having the capabilities to form good, secure attachments. There are 7 different criteria that psychiatrists take into consideration, and these are listed from A to G in the DSM-5. Criterion A states that there needs to be a consistent pattern of inhibited, emotionally withdrawn behavior towards adult caregivers, manifested by both of the following. 1, the child rarely or minimally seeks comfort when distressed. And 2, the child rarely or minimally responds to comfort when distressed. Criterion B states that there needs to be persistent social and emotional disturbances, characterized by at least 2 of the following. 1, minimal social and emotional responsiveness to others. 2, limited positive affect. These children will infrequently express positive emotions during routine interactions with caregivers. And 3, episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions with adult caregivers. Criterion C states that the child has experienced a pattern of extremes of insufficient care as evidenced by at least 1 of the following. 1, social neglect or deprivation in the form of persistent lack of having basic emotional needs or comfort, stimulation, and affection met by caregiving adults. 2, repeated changes of primary caregivers that limits opportunities to form stable attachments. An example of this could include a child who has jumped from foster family to foster family. 3, rearing in unusual settings that severely limit opportunities to form selective attachments. An example of this would include institutions with high child-to-caregiver ratios. If criteria A, B, and C are met, I will then screen further for criteria D through G. Criterion D states that the care in criterion C, whether it's neglect, repeated changes in primary caregivers, or being raised in an environment that limits opportunities to form attachments, is presumed to be responsible for the disturbed behavior seen in criterion A. Meaning that the disturbances seen in criterion A, whether it's a child minimally seeking comfort or responding to it when distressed, began following the lack of adequate care. Criterion E states that the criteria are not met for autism spectrum disorder. Criterion F states that the disturbance is evident before the age of 5 years old. And criterion G states that the child has a developmental age of at least 9 months. If all of these criteria are met and a child is diagnosed with reactive attachment disorder, the last thing that I typically do is specify whether or not it's persistent, meaning that the disorder has been present for more than 12 months. After I diagnose a child with reactive attachment disorder, something that I'll always screen for is the presence of developmental delays, and this is because many children will have delays in cognition or language because of the social neglect that they have experienced. Other things to take into consideration would be depressive symptoms and things such as severe malnutrition. It's unclear whether a reactive attachment disorder occurs in older children and how symptoms may or may not present differently. So it's often recommended that this diagnosis be made with extra caution in those older than 5 years old. Even though this diagnosis has gotten a lot of attention in the media over the years, it's a pretty rare diagnosis, and it's believed that even in children who have been severely neglected, which is the only major known risk factor for this diagnosis, only about 10% of them will develop reactive attachment disorder. So the vast majority of severely neglected children do not develop this disorder. Now head on over to the next video to find out more ways that you can help your child live their best life.